Welcome to this video on Seizures Nursing Mastery, a comprehensive review for nursing competitive exams. Let's start with a question. Which of the following is a classic manifestation of a generalized tonic-clonic seizure? The correct answer is tonic rigidity, followed by clonic jerking. Tonic-clonic seizures begin with a stiffening phase, followed by rhythmic jerking of the extremities. Next question. An aura before a seizure is best described as? The answer is a warning sign or sensory phenomenon. An aura is a focal warning sensation occurring just before a seizure, indicating the focal origin of the discharge. Status epilepticus is defined as a seizure lasting longer than? The correct answer is 5 minutes. Status epilepticus is a medical emergency defined as a continuous seizure or recurrent seizures lasting over 5 minutes without returning to baseline consciousness. What is the priority nursing intervention during a seizure? The answer is protect the head and ensure airway. Protecting the head prevents trauma, and ensuring an airway avoids suffocation. Never force objects into the mouth. Which medication is commonly associated with gingival hyperplasia? Phenytoin is the answer. Long-term use of phenytoin causes gingival hyperplasia, which is an overgrowth of gum tissue. Oral hygiene education is critical. The postictal phase is characterized by? The correct answer is confusion, lethargy, and sleepiness. After a tonic-clonic seizure, the patient enters the postictal phase, characterized by confusion, drowsiness, and fatigue. Absent seizures are most frequently seen in? Absent seizures, or petit mal seizures, are most common in children, presenting as brief staring spells. Which lab level must be monitored for valproic acid? The answer is liver function tests. Valproic acid can cause hepatotoxicity, so routine monitoring of liver enzymes is mandatory. Febrile seizures typically occur in children during. The correct answer is a rapid rise in body temperature. Febrile seizures are triggered by a sudden, rapid spike in fever in children. Which drug can cause Stevens-Johnson syndrome? Carbamazepine is the answer. It is one of the anti-epileptic drugs known to carry a risk of Stevens-Johnson syndrome. What is a key safety precaution for seizure patients? The correct answer is padding side rails. This helps protect the patient from injury during a seizure. Restraints should be avoided. Complex partial seizures involve? The answer is impaired consciousness with automatisms. These seizures are characterized by altered awareness and repetitive, non-purposeful movements. What is the first-line medication for status epilepticus? IV benzodiazepines, such as lorazepam, are the first-line medication to rapidly stop the seizures in status epilepticus. What is a myoclonic seizure? A myoclonic seizure is characterized by a sudden jerk or series of jerks. These are brief, shock-like contractions of muscles. What is a vagus nerve stimulator used for? The vagus nerve stimulator is used for terminating seizures in drug-resistant epilepsy, offering a non-pharmacological treatment option. Which test is essential for epilepsy diagnosis? The EEG or electroencephalogram is the essential test for epilepsy diagnosis, as it records the brain's electrical activity. What should you do if a patient bites their tongue during a seizure? You should protect the patient and absolutely not attempt to pry their mouth open. This prevents further injury to the patient. Which drug is safer for pregnant patients with epilepsy? Lamotrigine is generally considered safer for pregnant patients with epilepsy, though it still requires careful monitoring. What is an atonic seizure? An atonic seizure is a sudden loss of muscle tone, commonly referred to as a drop attack. Which side should a patient be placed in post-seizure? Patients should be placed on their side or lateral position, post-seizure, to maintain an open airway and prevent aspiration. Which is a common seizure trigger? Sleep deprivation is a common trigger for seizures. It is important to promote good sleep hygiene. Why is medication compliance essential? Medication compliance is essential to maintain therapeutic levels of the anti-epileptic drugs, effectively managing the condition.